Ischemic heart disease IHD equals coronary artery disease CAD. 1. Pathophysiology. Ischemic heart disease IHD, or coronary artery disease CAD, occurs when the blood supply to the heart muscle is reduced or blocked due to the narrowing or hardening of the coronary arteries. This condition is usually caused by atherosclerosis, where fatty deposits plaques build up inside the arteries. When blood flow is restricted, the heart muscle myocardium becomes starved of oxygen, leading to ischemia. IHD is the most common form of heart disease and a leading cause of death worldwide. It can result in chest pain, angina, heart attacks, myocardial infarction, heart failure, and arrhythmias. 2. Onset and duration. 4. Prognosis. 3. Prevalence. 5. Signs and symptoms. Chest pain, angina, shortness of breath, fatigue, heart palpitations, nausea or dizziness, sweating, myocardial infarction, heart attack. 6. Complications. Myocardial infarction, heart attack, heart failure, arrhythmias, angina, sudden cardiac death, stroke. 7. Causes. The primary cause of IHD is atherosclerosis, a condition where fatty deposits plaque build up inside the coronary arteries. This leads to narrowing of the arteries, reducing blood flow to the heart. Key risk factors for atherosclerosis include smoking, hypertension, high blood pressure, high cholesterol levels, diabetes, obesity, sedentary lifestyle, unhealthy diet, age, family history, stress. 8. Tests and diagnosis. Diagnosing IHD involves assessing symptoms, risk factors, and performing diagnostic tests to evaluate coronary artery function. Electrocardiogram ECG. Exercise stress test. Echocardiogram. Coronary angiography. Cardiac CT or MRI. Blood tests. 9. Treatment and medications. The treatment of IHD focuses on improving blood flow to the heart, relieving symptoms, and preventing complications like heart attacks. It includes lifestyle changes, medications, and sometimes surgical interventions. About lifestyle changes. Quit smoking. Diet, exercise, weight management, stress management. About medications. Aspirin, statins, beta blockers, ACE inhibitors, calcium channel blockers, nitrates, antiplatelet agents. About surgical/interventional treatments. Percutaneous coronary intervention PCI. Coronary artery bypass graft CAB. 10. Nursing points. Monitor for angina, assess and document the frequency, intensity, and duration of chest pain. Be alert for symptoms of unstable angina, which may require emergency intervention. Administer medications. Monitor vital signs. Recognize signs of heart attack. Quit smoking. Maintain a heart-healthy diet. Exercise regularly. Control blood pressure and cholesterol. Maintain a healthy weight. Manage stress. Support cardiac rehabilitation.